Have you ever wondered what exactly happens at a home birth? What kind of care do midwives provide in the home? The short answer is that midwives provide the same care at a home birth as you would expect from your midwife or doctor at a hospital birth. The healthcare system is brought to your door. Midwives in Ontario carry pretty much all the same equipment, supplies, and medications that are available in the average hospital labor room. We make sure the person giving birth is stable. Baby's heart rate is monitored routinely. We have instruments to manage episiotomies and tears, and instruments for clamping and cutting the cord. We can set up and run an IV. We have medications to treat bleeding, and if needed, we have the equipment and skills to help a baby to breathe. There are some differences between what we carry to a home birth and what is in a hospital labor room. For example, we do not bring the machine that can continuously record a baby's heart rate because that tool is only used if there are risk factors or complications. If that's the case, then we would have already recommended moving into the hospital. We also don't carry vacuum or forceps. These are rarely needed in a low-risk, normally progressing birth. If things slow down abnormally, or if the baby seems to be getting tired or distressed, then we transfer to hospital. Interventions like forceps, vacuum, and using synthetic oxytocin during labor only happen in the hospital because they increase the chances of complications. Midwives don't really carry out interventions at home births that increase the risks. Makes sense, right? All of the research says that midwives in Ontario offer care at home that is safe, if not safer, than standard hospital care. This is a fact for many reasons. One reason is that Ontario midwives are trained to identify red flags that warn that something is not quite right. We are also trained to identify the subtle indications that something might go wrong with a birth later in the process, pink flags if you will. If there are flags, then we develop an appropriate care plan. Most emergencies, if they happen at home, are dealt with exactly the same way as they are in the hospital, and the outcomes are the same. Long story short, routine births are handled the same way at home as they are in the hospital, with the same equipment, supplies, skills, and excellent outcomes. For more information about home birth or midwifery care in general, visit our website at generationsmidwifery.ca.